You might think your hygiene routine is just fine, but doctors instantly spot mistakes most elderly people overlook. And some of these slip-ups could be harming your health without you even realizing it. In this video, we'll uncover 7 personal hygiene mistakes older adults make, and mistake number 4? That one's downright shocking. Stay tuned, because knowing this might just change how you care for yourself forever. If you care about aging with grace, dignity, and good health, hit that subscribe button, like, comment your thoughts, and share this with someone who needs to hear it. Let's dive in and uncover the truth. Mistake 1. Bathing less, health suffers. As people grow older, the simple daily rituals we once took for granted, like bathing, can become increasingly difficult and, for some, even dangerous. Fear of falling, stiff joints, lack of assistance, or depression often leads elderly individuals to skip regular bathing. While it may seem harmless to go a day or two without a shower, this habit can quietly harm health and dignity. Doctors notice it immediately. Dry, flaky skin, unusual odors, and infections are all red flags. Bathing is not just about smelling fresh, it's a cornerstone of self-respect, hygiene, and disease prevention. The skin is the body's largest organ and becomes more fragile with age. Without regular washing, it collects sweat, dead skin cells, and bacteria that can lead to rashes, sores, or fungal infections. Seniors may assume that because they sweat less, they don't need to bathe as frequently. But aging skin still produces oils, and wearing adult diapers or certain medications can increase the need for cleanliness. Bathing just 2 to 3 times a week, using gentle cleansers and warm, not hot, water, can help maintain skin health without causing irritation or dryness. Doctors are trained to notice signs that indicate infrequent bathing, buildup behind the ears, underarms, or private areas, body odors masked by sprays, and general unkemptness. These signs speak not just to physical neglect but sometimes to emotional states such as loneliness, anxiety, or the onset of cognitive decline. In fact, when doctors see a patient who seems unusually disinterested in cleanliness, it's often a clue that deeper health issues may be present, ones that need to be addressed gently and compassionately. Some seniors resist bathing because it makes them feel vulnerable. Standing in a slippery tub or being helped by a caregiver can be uncomfortable or embarrassing. But with proper tools, like non-slip mats, shower chairs, handheld shower heads, and grab bars, bathing can become a safer, more comfortable experience. Loved ones should encourage a routine, not by scolding, but by helping to restore the joy and refreshment that comes from feeling clean and presentable. Another issue doctors often notice is skin that's overly dry or irritated, often caused by improper bathing products or skipping post-bath moisturization. Elderly skin needs extra care. Using fragrance-free, moisturizing cleansers and applying lotion right after bathing helps protect the skin barrier. These little acts add up to greater health and comfort. Bathing less doesn't just impact the body, it affects the mind. Feeling fresh can boost confidence, reduce depression, and encourage social interaction. Many seniors avoid family gatherings or outings because they're self-conscious about how they smell or look. A simple, consistent bathing routine can help eliminate that barrier, allowing for more meaningful connections and a better quality of life. In the end, regular bathing isn't about vanity, it's about preserving your independence, health, and pride. Doctors don't judge, they observe. And when they see signs of neglect, it's their cue to dig deeper, offer support, and help you return to routines that honor your well-being. Bathing is a basic act, but its power in preserving dignity and life should never be underestimated. Mistake 2. Scents hide bigger problems. As we grow older, many of us start using stronger perfumes, body sprays, or powders, often with the innocent intention of smelling pleasant or masking minor body odors. But to doctors, the overuse of these products is an immediate signal that something might be wrong. Strong scents may cover the signs of poor hygiene, but they do nothing to address the actual issue. In fact, they can create entirely new problems, from allergic reactions and skin irritation to respiratory distress. Especially in sensitive individuals. What's worse, they can give a false sense of cleanliness that encourages further neglect of basic hygiene. The elderly often turn to scented powders or colognes as a substitute for bathing or fresh clothes. These habits might be rooted in nostalgia or limitations in mobility, but they don't fix the underlying problems. A fresh scent might feel comforting or even familiar, but when it's layered on top of unwashed skin, doctors can detect the truth immediately. Heavy use of fragrance is frequently a red flag in clinical settings, especially if paired with dry, patchy skin or stained clothing. It's not the scent itself that's the issue, but the attempt to mask what truly needs attention. Doctors routinely observe that excessive use of scented products can be an unconscious cry for help. It may signal a person is no longer confident in their ability to keep up with hygiene or may be unaware of their own scent due to aging senses. In other cases, cognitive decline, depression, or physical limitations may be behind the avoidance of proper cleaning routines. Scented cover-ups then become a coping mechanism, a way to feel normal in a body that's becoming harder to manage. While the intention behind using perfume or powder is understandable, the reality is that such products can irritate aging skin, clog pores, and even lead to fungal growth if the skin isn't clean beforehand. Instead of helping, they can trap bacteria and sweat, especially in folds of the skin. This creates the perfect environment for infections. Doctors often encourage a return to basics, gentle washing with mild soap, clean clothes, and applying fragrance only as a final, finishing touch on clean skin. It's also worth noting that many commercial products are not designed for sensitive or mature skin. Elderly individuals should use alcohol-free, hypoallergenic options and avoid spraying directly onto the skin, especially in delicate areas. The use of natural, mild scents like lavender or chamomile can offer a comforting fragrance without overpowering the senses or irritating the body. The lesson here is simple: a pleasant scent should enhance your hygiene, not replace it. Doctors can smell the difference. Instead of relying on artificial cover-ups, focus on regular cleaning habits, proper laundering, and skincare. That will always leave a more lasting and healthier impression, both on your body and on the people around you. Mistake 3. Dentures need daily care. Dental hygiene often becomes an afterthought in old age, especially for those who no longer have natural teeth. Many seniors assume that without teeth, there's little need for daily cleaning, but doctors and dentists know better. Dentures, partials, and oral appliances collect food particles, plaque, and bacteria just like natural teeth. When these devices aren't cleaned properly each day, they become breeding grounds for infection, odor, and gum disease. Doctors notice dry, irritated mouths, bad breath, and even facial sores, all telltale signs that oral hygiene is being overlooked. Worse still, the effects of poor oral care don't stay in the mouth. Bacteria can travel to the bloodstream and affect heart health, increase inflammation, and contribute to serious systemic conditions. Daily cleaning of dentures involves more than a quick rinse. They must be brushed thoroughly with a soft bristle brush and non-abrasive cleanser to remove plaque and stains. Dentures should also be soaked overnight in a disinfecting solution to kill bacteria. Just as importantly, the mouth itself needs attention. Gums should be gently brushed or massaged, and the tongue should be cleaned to reduce odor-causing bacteria. These steps ensure that the entire oral environment remains healthy and comfortable. Doctors often see seniors suffering from oral pain, yet dismissing it as normal. But soreness, dry mouth, or trouble eating could all indicate that dentures aren't fitting correctly or haven't been cleaned well. Ill-fitting dentures can cause ulcers, difficulty speaking, and lead to nutritional deficiencies due to limited food choices. A regular checkup with a dentist can ensure that everything fits properly and functions well. Even if there are no natural teeth left, dental visits are still necessary for monitoring gum health and screening for oral cancer. Clean dentures also influence social confidence. Many seniors avoid smiling or speaking freely because of embarrassment about odor or loose-fitting devices. This emotional weight often leads to isolation, which impacts mental health. But when dentures are clean and comfortable, seniors feel more presentable, sociable, and proud. Maintaining a bright smile, even in later years, boosts self-esteem and helps preserve a vibrant spirit. Caring for dentures daily is not just about appearance, it's about safeguarding health and confidence. A mouth that's clean and pain-free allows seniors to eat better, speak clearly, and engage with life more fully. Doctors always notice when oral care is neglected, and fortunately, it's one of the easiest areas to improve with just a few small daily habits. Mistake 4. Same undies, shocking consequences. It may sound uncomfortable to talk about, but one of the most shocking hygiene mistakes elderly individuals make is wearing the same undergarments for several days in a row. Doctors instantly pick up on this habit from odor, skin rashes, or visible signs of irritation. While it might seem harmless, especially if there's minimal sweating or the person is largely sedentary, the consequences can be severe. The skin in intimate areas becomes thinner and more sensitive with age. Extended wear of undergarments without washing traps bacteria, leading to urinary tract infections, yeast overgrowth, and painful skin breakdowns. Seniors may struggle with laundry or avoid frequent clothing changes due to pain, arthritis, or even memory issues. But this hygiene mistake quickly becomes apparent. Doctors often see patients with unexplained itchiness, sores, or discoloration in the groin area, all of which stem from poor underwear hygiene. Clean undergarments every day are a basic yet powerful form of self-care, offering protection, comfort, and dignity. Disposable underwear or easy wash options can help those who find laundry difficult. Family members or caregivers should discreetly assist in ensuring there's always a fresh set available. Beyond infection risks, wearing the same underclothes impacts mental health. Individuals begin to feel less confident, avoid going out, and may even distance themselves from loved ones. There's a deep psychological connection between feeling fresh and feeling valued. Changing into clean underwear is not about vanity, it's about reclaiming pride and safety in your body. Doctors won't shame you, but they will advise you. They understand the obstacles elderly people face, and they recommend setting small habits, placing a clean pair of undergarments by the bed each morning or using calendar reminders. It's never too late to restore routines that make life feel normal, safe, and empowering. Don't let something as simple as underwear rob you of your comfort and dignity. Mistake 5. Forgotten feet, rising risks. Feet are often the most neglected part of elderly hygiene, and doctors know this all too well. When seniors come in for checkups, physicians immediately inspect their feet for signs of fungus, calluses, sores, or poor circulation. Foot hygiene is not a luxury, it's a vital part of staying independent and mobile. As mobility decreases, it becomes harder for seniors to reach their feet, leading to missed washings, untrimmed toenails, and hidden infections that can worsen rapidly. For diabetics, this can be especially dangerous, as unnoticed foot wounds can turn into ulcers and, in severe cases, result in amputation. Neglected feet also contribute to foul odor and discomfort. Bacteria thrive in the warm, dark environment inside shoes and socks, and without regular washing and drying, especially between the toes, fungal infections become inevitable. Shoes should be kept clean and aired out regularly, while socks must be changed daily. Seniors should wash their feet each day. Dry them thoroughly, and moisturize the heels to avoid cracks that can bleed or become infected. Doctors also notice signs of poorly fitted footwear and overgrown toenails, which can cause pain, instability, and falls. Fall prevention begins at the feet. Well-cared-for feet promote balance and reduce the risk of slipping. For those who struggle to reach their feet, family members or professionals can assist with basic care. Podiatrists also offer routine trimming services and foot checks that are often covered by insurance. Caring for your feet isn't just a physical act, it sends a powerful message: you're grounded, stable, and prepared to stand tall. It reflects self-respect and readiness to stay active and engaged with the world. Doctors notice healthy feet, and they see it as a sign of a well-rounded, responsible life. Mistake 6. Dirty hands, silent threat. Washing hands might seem like a childhood lesson, but for seniors, it remains one of the most important and often overlooked hygiene habits. Doctors quickly spot patients who aren't washing their hands regularly. Grime under the nails, lingering odors, or recurring infections are all signs. Dirty hands are among the biggest carriers of illness, especially in older adults whose immune systems are weaker. Every surface touched, from doorknobs to remote controls, carries germs that can enter the body when hands touch the eyes, mouth, or food. Infections like colds, flu, or gastrointestinal bugs often stem from poor hand hygiene. Seniors with dementia or arthritis may find it harder to remember or physically wash their hands, but this small act has massive health consequences. Doctors emphasize the importance of washing with soap and warm water for at least 20 seconds, particularly before meals, after bathroom use, or when returning from outside. Dry or cracked skin from overwashing can be eased by using a moisturizing hand soap or lotion afterward. If mobility is an issue, keep hand sanitizers in convenient places as backup. Clean hands also prevent the spread of illness to grandchildren, caregivers, or housemates. A simple rinse becomes a shield, protecting both yourself and those around you. Hand hygiene is a mark of awareness, care, and responsibility. Doctors who see clean hands often see fewer infections. This tiny habit carries a powerful message. You're still in control of your health, your safety, and your life. Mistake 7. Unwashed sheets, hidden dangers. There's a quiet comfort in familiar sheets, but when bed linens go unwashed for weeks, they become silent enemies of health. Elderly people often don't realize how quickly sheets gather dead skin cells, body oils, sweat, and even dust mites. Doctors who examine patients with chronic skin conditions, rashes, or pressure sores often trace the issue back to poor linen hygiene. When seniors stay in bed more often due to mobility issues, the need to wash sheets increases, not decreases. Bedding should be changed at least once a week. If laundry is difficult, consider using lightweight, quick-drying sheets or seeking help from family or home services. Mattress covers, washable pads, and pillow protectors can reduce buildup and simplify cleaning. Clean bedding promotes restful sleep, lowers skin irritation, and reduces allergies. Doctors take note of patients who sleep in soiled sheets. It's often tied to depression or cognitive decline. Addressing this hygiene habit can be the first step in restoring dignity and comfort. There's something deeply rejuvenating about slipping into fresh, crisp sheets. It reinforces the idea that you deserve care, cleanliness, and peace at the end of each day. Clean linens are more than just fabric. They're a symbol of self-worth, a signal to doctors and loved ones that you value your space and yourself. Conclusion. Now you know, these 7 hygiene mistakes may seem small, but doctors notice them immediately, and the consequences can be more serious than you'd expect. Cleanliness is not just about looking presentable, it's about dignity, health, and living with pride, even in your golden years. Don't wait until someone else points it out. Take control today and feel the difference tomorrow. If this video opened your eyes, give it a like, share it with a friend who needs to hear this, and drop a comment below about which habit surprised you the most. And don't forget to subscribe for more honest, life-changing content made just for you.